all for joining us tonight. And to those of you who are, it looks like most of you are from our side of the Atlantic, so you didn't have the time kerfuffle that I had with Deborah trying to figure out what time it was in Sydney, Australia after the daylight savings time ended on Saturday. Fortunately, Dr. Lupton was flexible enough to accommodate the fact that we thought it was at 9 in the morning in Sydney, but it's actually 11 in the morning there now, or 11:06 by our time. So thanks again, Dr. Lupton, for being flexible with that. And we're just thrilled to have you with us. Tonight's event is organized by the Rutgers Digital Ethnography Working Group, which is located within the School of Communication and Information at Rutgers University in New Jersey in the United States, where Jeff Lane and I both teach. We are the co-founders and co-organizers of this group. Our graduate student coordinator, Holly Avella, who could not be with us tonight because she's teaching, but is just the person who keeps us all together and is also the designer of our new website. Just very briefly to tell you about our working group, we support active digital ethnographers and researchers within the Rutgers School of Communication and Information community and beyond. And we aim to support and promote our members in their output and networking. We provide internal resources, meetings and writing groups, as well as public events like this one that brings Dr. Lupton to us. So Jeff will put our contact info in the chat and all that stuff if you want to join our mailing list or just find out more about what we're up to. Now I want to not even say any more besides introducing and welcoming Dr. Lupton with us today. Dr. Lupton is the Sharp Professor in the Faculty of Arts, Design and Architecture at the University of New South Wales in Sydney, Australia. There are really not enough superlatives to describe Dr. Lupton's contributions to our understanding of social processes in fields including medicine and public health, risk, the body, and digital media. She has a background in sociology and media and cultural studies. And those of you who are familiar with her research, as I imagine many of you are, know that she combines qualitative and innovative social research methods within sociocultural theory. Dr. Lupton is the author or co-author of 19 books, including most recently Data Cells in 2019, The Face Mask in COVID Times, 2021, and COVID Societies, Theorizing the Coronavirus Crisis, which is forthcoming from Rutgers. And this book is to provide key overviews of sociocultural theories that can help us make sense of the diverse and very complex elements of the COVID crisis. She has also edited or co-edited a further 9 books and published over 200 peer-reviewed journal articles and book chapters. So one of my questions to you is going to be about the incredible commitment of this prolific output and how your publications manage to always be so at the forefront of our thinking about social problems as they emerge. In tonight's presentation, Dr. Lupton is going to discuss how ethnographic research has responded to the conditions of the COVID-19 crisis. Not only did people around the world suddenly face new ways of living and being when the pandemic erupted, as she explains, but ethnographic researchers had to deal with tremendous challenges posed by, among other things, restrictions on face-to-face fieldwork. So we've invited Dr. Lupton to discuss what she has learned through this time and how she has engaged in innovative research methods to help make sense of the crisis. And I really appreciated the title, Ethnographic Methods in, with, and through COVID. So welcome, Dr. Lupton, and we're so glad to have you among us. Yes, great to have you here.
Thank you for that lovely introduction, Melissa, and thank you, Melissa and Jeff, for inviting me to speak to your group today. It's wonderful to be here all the way across time zones and space. So I'm just going to put on my smartphone timer so that I keep to time. All right, so it's all happening, and I will share my screen. Okay. Everyone can see that it's okay? Excellent. Well, the text so far is working well, which is great. This is the topic for today, methods for ethnographic researching with and through the COVID-19 crisis, which Melissa and Jeff would sort of, in conversation, they were keen for me to talk about. So that's what I decided I would focus on today. You'll see I have a lot of affiliations actually. So I lead the Vitalities Lab, just a small group of researchers at my university, but I'm also a Chief Investigator in the Australian Research Council Centre for Automated Decision Making and Society, which is a huge multi-university centre of excellence. We're one of the universities involved in Australia, but there's 8 other universities in Australia involved in this big centre of excellence. But I'm also part of 2 research centres in my university, the Centre for Social Research in Health and Social Policy Research Centre in the faculty. Oh, I haven't changed it to our new name. It should be Arts Design and Architecture at UNSW Sydney. We recently had a name change. So yes, I sort of wear a lot of hats. And I also like to do, I guess as Melissa gestured to, I like to do sort of focus on a lot of topics. I guess I've got a low boredom threshold, so I like to move around and explore lots of different dimensions of it, but it all really gets back to people's experiences of everyday life and people's experiences of embodiment through lots of different ways of moving through the world, thinking about selfhood, social relations. And in recent times, I just thought I'd do a quick kind of overview of the theoretical perspectives that I've been engaging with and finding really generative for my empirical work, because I do usually try, I mean, I wouldn't call myself a social theorist at all. What I try to do really though is bring together empirical work with social theory in a way that kind of brings the findings of my empirical work to life and provides some kind of explanation at a broader level of why it is that people think in certain ways, why they feel in certain ways, why they act in certain ways. And what I call more than human theory is approaches that have really underpinned a lot of my work in recent years. And the more than human theory I work with, of course, there's lots of, I mean, a lot of people would use the term socio-materialism or new materialisms, or even post-humanism. I prefer more than human theory because I think there's, for example, post-humanism tends to be used in very different ways by very different groups of people to mean different things. So I tend to avoid that. And I find more than human theory really encapsulates better the kinds of perspectives and concepts that I like to work with. And you could, I guess, draw a distinction between what I've called old materialisms and new materialisms. So old materialisms is work from the philosophies and cosmologies and worldviews of Indigenous and First Nations and non-Western peoples and cultures. And I've really been trying to read a lot more as a non-Indigenous person, as a member of the settler group of people in my country, in Australia. I have Anglo-Celtic origins. I'm 4th generation Australian. All my great-grandparents came from pretty much Ireland, Scotland and England. But of course we have the oldest living culture in Australia, the Indigenous culture in Australia. And I have made it my business to learn a lot more about Indigenous knowledges in my own context, my own cultural context, because really they have been practicing and thinking and learning about the more than human dimensions of humanhood, human nature, human experience for many thousands of years, as have, of course, First Nations communities in other settler societies, and as have many non-Western societies, including, for example, in Asian context or African or South American, Latin American context. Yet we, in settler societies from European backgrounds and in European philosophy, the idea of new materialism or post-humanism tends to be promulgated, written about by white people who often don't recognise that non-Western and Indigenous First Nations perspectives have been around for a long time. And in fact, new materialism is really not that new. And the philosophers that I've been working with, Donna Haraway, Rosie Braidotti, Karen Barad, and Jane Bennett in particular, are of course all white people from European backgrounds, living in the Northern Hemisphere, living in the global North. And they have been subjected to criticism, I think rightful criticism, for not acknowledging these previous pre-Enlightenment cosmologies and philosophies that I'm trying to engage with. And I'm doing my best to cite and, you know, read and cite as much or as more as I cite those feminist materialist theorists that I mentioned below there, whose work I do find very engaging, very productive. But I think we also have to acknowledge that they are really reproducing thinking that has been around for a long time. And I think we as settler societies, people from non-Indigenous backgrounds, really need to acknowledge that. So I'm trying to do that more and more as an ethical, but also as a knowledge producing practice in my own work. All that is to say, though, that what I'm interested in is these dimensions, drawing on both old and new materialisms. So as the term more than human theory implies, this is understanding that humans are always, we really speak about human bodies or human selves, but of course they are never limited to the human body. We are always parts of assemblages with other humans, but also other things, places and spaces, objects and so on. So the theories and concepts that I'm working with, there's three main ones. The first one is understanding context, so the view from somewhere, and Donna Haraway does talk about, you know, the God view, the view which imply, you know, in a lot of science, for example, that implies that a perspective on something is always the same and is universal, but of course we know as social researchers that that is not the case, that there is always a view from somewhere. We are always living from our own perspective and seeing the world from our own perspective. And those contexts, though, are dynamic. They are constantly changing because we are constantly changing. We as researchers are moving through time and space and interacting with other humans and non-humans in different ways throughout our days. And secondly, that gets back to the understanding liveliness, the constant change in more than human worlds. And that's something I really try to sort of focus on in my own research as well. And thirdly, understanding the more than digital dimensions of digital tech use. If we're going to focus specifically, and as we are today, on digital technologies and media and software and practices related to the digital, one thing that I'm also trying to focus on in my own work is understanding that whenever we're engaging with digital devices and software, we are also engaging with non-digital dimensions of our lives. And again, that gets back to other humans, other things, and place and space in which we use our digital devices. And, you know, it's quite ludicrous when you look at the recent discussions by Mark Zuckerberg around, you know, the metaverse, and of course the new naming of his corporation as Meta. And when you look at all the promotional materials around that, implying that we are going to, you know, become part of the singularity. I mean, that going back, I mean, I was writing about cyberspace back in the mid-1990s, and we see that going back to these ideas that we can leave the body, the flesh of the body behind and you know, enter this meta world where we're doing everything digitally. I mean, it's just crazy thinking and totally fantastical because we, of course, are always part of more than digital worlds in our lived experiences. So it's really interesting to me that this discourse of sort of the new cyberspace has now become prominent in the internet empire's discourse of where they'd like to go in the future. Either that, or they want to zoom into outer space and leave the physical world behind to go into non-earthly spaces. Okay, so in terms of digital cultures, these are the dimensions that I like to think about in my own work. So I'm interested in the technological imaginaries that means getting back to the metaverse, the sort of ideas and imaginaries that promotional discourses encapsulate about the future of digital cultures and where digital media and devices will be going and what they can offer us as humans. And they're often very solutionist, of course. They're techno-utopian, that we can solve many wicked problems with this fantastic new digital device. Related to that is the affordances of the devices and software. What is actually baked into devices and software? What can they offer human users? I'm also interested in how the technological affordances interact with, or as Barad would say, interact with bodily affordances. So we have our own fleshly bodies that have capacities such as memory, such as learning from lived experience through our multisensory engagements with the world. And I'm interested in how those affordances of our fleshly bodies come together with the affordances offered to us, or in fact don't always come together, in fact sometimes clash or don't work well with the affordances offered by digital devices and software. I'm interested in other people and living creatures. That gets to the more than digital dimensions of our experiences of digital cultures, and how they are part of our experiences of the digital world, and place and space and other things, brings in that more than digital dimensions. And also the digital knowledge economy, which I guess gets back to the sort of political and economic dimensions of the infrastructures and social structures that we engage in digital cultures through and with. And I guess that's bringing my sociological perspective to come to bear, because as a sociologist, of course, we are always interested in the broader social structures and the economic dimensions of people's everyday lives and experiences. So that's always there at the back of my mind as well when I'm thinking about digital inequalities, for example, and lack of digital access that not only social groups in high-income countries continue to experience, such as in Australia with our Indigenous groups who live in remote communities who have very little digital access still, or even non-Indigenous people who live in remote and rural communities in Australia still have very little digital access, such as Wi-Fi or phone services, let alone the vast majority of the global south and low-income countries in the global south. So I've just actually recently published a report. I was on a global commission that looked at digital health and young people across the world, and we had some very interesting commissioners from low-income countries who were able to basically say, you know, there are many parts of our country, and say in Africa, where there just still is no access to smartphones, let alone other forms of computing and Wi-Fi. So all this techno-utopian discussions of how digital health services can be offered to promote universal health access, well, let's just go back and look at the actual infrastructures around that, which are still very limited in many countries of the world, low-income countries of the world. So getting to the COVID crisis, and one thing that many of us face who do fieldwork, face-to-face with fieldwork and traditional face-to-face methods, faced when restrictions came in our own countries, lockdowns and stay-at-home restrictions. In my country, it was from mid to late March. In 2020, we were quite early in implementing very strict lockdowns to prevent the spread of the virus. But then as social researchers, we were faced with that question of now, what do we do? Many of us had projects already underway. I myself had face-to-face an ethnographic project, which actually involved visiting people's homes in Sydney, going into their homes with a video camera and getting them to take us on a tour of their homes and showing us the digital devices that were in their homes and talking to them about the digital data that were generated by those devices. And we've done a few of those, just in February 2020, we've done a few of those home visits. And of course, wham, suddenly we were unable to do that. We had to think very quickly about how we were going to continue on with our fieldwork. So we were, I'm sure, well, I know that we weren't alone in facing that dilemma of what on earth we can do now to continue our research. you know, many of us weren't able to delay the project. I had a postdoctoral fellow working with me who I couldn't like sack, you know, fire and then say, come back later. I wanted to keep her employed and busy working on the project and meet our timelines. So one thing I did at that time in March and into April 2020 was I started the document Doing Fieldwork in a Pandemic, which some of you may have heard about. And it was a very simple process, actually. Once I got this, it was a Google Doc crowdsourced resource. And just using a very simple software, Google Doc, I started a Google Doc under that title. And I put some content in it, basically said, you know, digital pracy. Many of us are being confronted by stay-at-home restrictions or lockdowns. How do we continue on with our research in a context in which we can't actually meet with people face-to-face anymore, at least for the continuing, you know, the foreseeable future? And because I have quite a big Twitter following, I was able to tweet out the link to the Google Doc, and it was retweeted in that wonderful exponential way that Twitter works. And I was really pleased and excited to see that so many people around the world engaged with the document and contributed to it. And within a couple of weeks, really, I had almost 40 pages of wonderful suggestions and alternatives for how to do fieldwork in a pandemic, which was fantastic. It was really great to see people working together in that crowdsourced way. I, you know, totally didn't expect, you know, that it would take off so well, but I guess that there was a zeitgeist going on. You know, we were all facing this dilemma, and so it was wonderful to see people engaging with this and contributing to it and sharing it. And I got, you know, wonderful suggestions from people. Can I share it with my research group? And of course I said, yes, you know, this is what it's for. Please do share it with your students. I saw that it was shared on a lot of research networks or departments or research centres websites, which was fantastic. That was totally what it was for again. So it was really fantastic to see the worldwide take-up of this resource. And I also, it's interesting too, I see it's already been cited 40 times in academic publications. So, you know, I'm really, really pleased to see how helpful it has been for people. And it was helpful for me because I was able to get some ideas myself for what to do myself, and to take up with some of my ideas and to come up with my own ideas as well. What I also did around this time was, because I could see the hunger that there was out there in the research community, social research community, for how to do innovative methods, as well as methods to deal with COVID lockdowns. With my team in the Vitalities Lab, we decided to do a series of short form methods explainer videos it's called Breaking Methods. You can look it up on YouTube. And we've done a set of little videos there that we thought would be useful for people who, of course, were also trying to teach research methods online suddenly. And we deliberately designed those little videos explaining different types of innovative methods, just so that so that people could use them in their teaching. That was the whole point of doing them. So that was sort of an outreach approach that we took at that time as well, that tied in with the Doing Fieldwork in a Pandemic document and sort of built on that and supplemented that. And that's just a screenshot from our YouTube channel showing what it looks like. Do Google it, maybe somebody could maybe put a link in the chat if they haven't already, if people want to check it out. We do have a lot of subscribers now and a lot of views, which is fantastic to see that's been engaged with. Okay, so in terms of the main types of methods that came up in the Google Doc that people were suggesting. So there's two main methods really that were suggested and that we could use going forward. And so transforming traditionally face-to-face methods into distance methods. So ways of adapting our methods using not always digital technologies, and I'll talk about this in a minute, but mostly digital technologies such as video messaging apps, for example, or Zoom, to interview people and to do field work. But also there was a lot of suggestions for born digital content. So already distance methods, so ways to scrape certain kinds of digital data from websites where people were already engaging in online interactions with each other. And of course, that kind of digital ethnography has been done for a long, long time. But I guess people became more interested in it following restrictions on face-to-face fieldwork, and people who hadn't already, I guess, engaged with it or learned how to do it got some tips from looking at the fieldwork document and looking at the different kinds of methods that were available. But it's not all about the digital. I really want to emphasize that. And that gets back to what I was talking about earlier about digital access. So if you are dealing with a participant group who don't have a lot of digital literacy or don't have a lot of access to digital technologies or Wi-Fi, for example, then there's no reason why you can't do some really interesting research methods in a remote way using things that you can send through the mail, through the snail mail, or drop off at people's doorsteps in a physically distanced way, pick up again in a physically distanced way, or yeah, just through the mail or through a courier service. And so paper diaries, I mean, that kind of reinvigorates, I think, some of these old methods of just pen and paper diaries, asking people to do paper diaries, drawings, handwritten creative responses, mapping exercises using hand-drawn maps, collaging, letters, writing letters, and cultural probes. And these are some methods that I've been experimenting with myself lately, and I'm going to give you some examples. And also, but don't forget the ethical implications, and that's something that I did want to emphasize in the doing fieldwork in a pandemic document as well, because of course you do need to consider things like privacy issues when conducting fieldwork in shared household spaces using digital technologies, using video calls, for example. When you're sharing a physical space with someone, you're in there with them, you can see who else might be around, and you can sort of be careful about, you know, how their privacy is shared. But you can't tell as easily when you're doing a Zoom call with them who's around and who could hear them, and you know how, if you're talking about very sensitive issues, then obviously you don't want to flout people's privacy. So that's something to really consider. There's also the digital data privacy issues, and for those people who are in Europe, the GDPR and those kinds of regulations, they have to be very careful about in terms of how they collect people's digital data using digital technologies, and to consider that. And something that certainly was an issue top of mind for me and my research team when we had to convert from in-person fieldwork to online fieldwork was revised ethics applications. So of course we already had ethical approval to do fieldwork in people's homes. We had to go back to our ethics committee and get a modification for that so that they could approve us doing it using video messaging apps. So there was those kinds of things that to consider, and they do get covered in the doing fieldwork in a pandemic document as well, if you'd like to check that out. So in terms of recent projects that I've done, so I'm just going to give some examples. So some of these were conducted before the pandemic and some of them during the pandemic, but they all involve innovative methods that can be done either online or face-to-face. But they're also innovative methods that I was interested in experimenting with, just because I'm certainly not saying that traditional approaches to social science research, such as interviews, focus groups, participant observation, or ethnographic work, actually visiting people's locations and spending time with them, I'm certainly not saying that they are not important and necessary and very, very useful and insightful ways of doing social research. And I've done all those things a lot and will continue to do those approaches a lot. But I also do like experimenting with different ways to do social research, because I think that you can actually get different insights, particularly in terms if you're interested in the sort of affective dimensions of people's experiences of everyday life, how they feel about things. You can't always really get at those things by sort of directly asking them sometimes. sometimes going at it at a more oblique way, asking them to do just some creative methods to make something, and then using that artifact that they've made as a stimulus, as a probe, as an elicitation material, and discussing what they've made with them and talking to them as they explain what was going through their mind and what they were feeling as they was making that artifact, I find can be a really insightful and generative approach to social research. And I also find that participants really enjoy it as well. So, you know, people like talking about themselves in interviews, but they actually do enjoy being creative as well. So it's kind of can be fun for both the researcher and the research participant. So this first example, sources of health information, was a project I did do before COVID. And I've been experimenting with the story completion approach, which is basically comes out of psychology research or even psychiatric therapy, where you ask people to complete a story about a fictional protagonist. And it is an oblique approach because people aren't talking about themselves, but of course they really are talking about themselves, because the only way you can really complete a story about a fictional person is to draw on your own lived experience and feelings, because that is how we all are able to come up with imaginative stories, really, only building on our own experience. And you give people the beginning of the story and you ask them to complete it in their own words in any way they would like to. So I did that I had 4 story beginnings. We call them story stems in this approach. And they were each about a health dilemma. And I was really interested, without asking people directly, I was really interested to see if in the stories people would talk about the story protagonists seeking, well, if they sought digital support, online support, or using apps, or whether they went to the doctor. Oops, sorry. Hang on, I'm going forward when I should be going backward. There we go. Without directly asking them, I wanted to see what solutions they would come up with. And this also led into poetic inquiry, because the language that people were using to describe how people responded to the health dilemmas, in some cases were just so moving and so resonant that I thought you could actually make poems out of these people's words. So I did publish a piece where I made poems from some of the pieces of people's stories. So that was unexpected. I wasn't planning to do that, but it was interesting. And it was I found when I read out the poems when I gave talks on that project, I mean, it really resonated with a lot of people too. And again, it really brought up the affective dimensions of people's experience. In a project on people's understandings of algorithmic cultures, we used zine making, because one of my team members, Ash Watson, she was in the Vitalities Lab, she's now with my Centre of Excellence team, is an expert zine maker. So it was really fun to experiment with that. We also use creative writing prompts and hand-drawn maps. And I've got some examples to show you. Again, getting people just to sometimes work together in a group, sometimes as an individual. When you're working together in a group, it's interesting how people talk about things as they're making things as well. So we video the whole thing, and we have the video as a resource to draw back on if we're interested in just what people are saying about the experience of making these artifacts or writing these artifacts, as well as the discussions after they've made them. And thirdly, people's use of digital technologies during COVID. So actually one of the serendipitous things was that with that project that I talked about, when we were visiting people's homes in Sydney and looking at and videoing them, talking to them about the devices they had in their homes, of course, post-COVID, everyone was in their homes more than ever, working from home, supervising their children, learning from home. And we were able to absolutely leap on that moment and continue our project and talk to them about what it was like in the home space during COVID lockdowns as they were working and learning from home. And so we did use instead of going to people's homes physically, we ended up using just Zoom on people's devices. We had a desktop computer that we linked to people's mobile device with, and they took us on a video tour of their home, showing us with their phones as they walked around their home, holding their phone up like this with my phone, walking around, and we would say, talk to them on the Zoom app, and we'd say, oh, and so what's this room? And please show us what technologies, digital tech you have in this, and they'd show us with their phone, and we would talk to them in real time while they were doing that. Now, of course, that has pros and cons, because not being in the room with them, we couldn't sort of look around and say, oh, by the way, what's that over there? We had to rely on their perspective. But the pro of that is that in some ways that did preserve people's privacy even more, because they were choosing what they were showing us. Whereas if we were there in the room with us, we could sort of pipe up and say, oh, by the way. So it's interesting. All research methods have pros and cons. All have limitations, but all have benefits. So, it's interesting just to consider. We have written a few pieces on this, actually, just considering the pros and cons, which are under review at the moment. So hopefully they'll be published before not too much longer. Hopefully they'll go through review and be accepted quite soon, because we have, we've reflected on these issues. So we did video ethnography using people's phones and Zoom. We did hand-drawn maps, and people did those maps for us and then sent us through copies. Excuse me. And we used creative writing prompts in online workshops. And we made case studies bringing together all these materials. So we had the video ethnographies, we had screenshots from the ethnographies, we had the maps that they drew, we had the discussions about the maps and about the creative writing prompts. So we put them all together and made detailed case studies for each participant. Excuse me, I've got a bit of hay fever because it's spring. Spring here in Australia. So this is just an example of pages from the zines that I was talking about. And they, as you can say, they're very vibrant materials that people can make using this method of sort of bringing collaging together with words that people have cut out of various materials, and really just, this was about how people feel about algorithmic decision making. But we gave them a whole lot of materials from children's books, from magazines. We had some quotations from academic articles, and we just asked people to combine them in any way they like to make a zine, which we then published online and I wrote a journal article about, which was published in Qualitative Research, that journal. And had discussions with people about what they created. The Living with Personal Data project is a project I've been talking about, where we did went into people's homes. So these are just, we had the video ethnographies when we went to people's homes, first in person, but then later using Zoom to get them to do the home visits with us. We did the hand-drawn mapping of showed them, that's an example in the middle there of someone working on their map. On the left there is just a screenshot from when they were showing us around their homes, and they were showing us their work from home set up there on their kitchen table. And we got them to do a map of the devices in their home so that we could talk to them just about which devices were connected, which weren't, and who used them, and so on. We just used that as a discussion prompt. And there on the right-hand side is an example of creative writing prompts, which was part of the same project, which we did with different group of people in online workshops. And this is just a prompt we gave one of the workshops. We asked them to write a love letter or a breakup letter to their data. So this is one example. Dear data, here are 10 things I hate about you. And they go on to list them. Again, we were really, really interested in how people feel about their personal data. And that's why we chose this particular prompt. It was very much about, love letter or a breakup letter was really getting us. For example, I hate the way you always see the things I secretly desire. I hate the way you can pick up on when I need someone to hire. For example, So lots of really interesting research materials there to work with. And of course, the discussions that we had with people about what they wrote as well, we are able to use in our case studies that I was talking about previously. Here's just some other examples, screenshots from people's houses when they took us around. Another activity that we did with creative writing activity that we did with people. We talked about facial recognition technologies there in that particular writing activity. At the top right-hand corner there, that's from a different project where we're using cultural probes there to ask people working in startup companies how they design their new devices. So that's a project we're currently doing. Then there's another map of someone's house and the digital devices in their house at the bottom there on the right bottom. Again, just as an example of the artifacts that we've generated in these workshops and home visits. I've just listed here some books on innovative and creative methods that people might like to look up if they're interested in engaging with some of these methods that I've been talking about. Lots more methods here listed by people. And there's a bit of a plug here for a new book that literally just came out, that was just published this week, that I edited with my colleague Dina Lay, who's an education academic at Monash University in Melbourne. And it's called Creative Approaches to Health Education, New Ways of Thinking, Making, Doing, Teaching and Learning. And we've got some fabulous contributors in this book who draw on arts-based and design-based methods. We're taking a very broad, I mean, it's not actually all about, in fact, there's probably not a lot about digital devices, but because another hat I wear is health sociology, I've been very interested in the ways that people engage with health messages or think about their bodies in relation to health conditions or disease or risk. So that's really why I've been a very kind of public I do a lot of public criticism of a lot of health education campaigns, which are incredibly based on self-responsibilization. I wrote an article called The Pedagogy of Disgust a few years ago, because I really think there's a lot of ethical implications about making people feel disgusted about their bodies. Anyway, that's a whole other area of research. But that is just an example of my interest in health education. But we're talking about health education across different age groups, school students up to, for example, people struggling with mental health, women who have given birth and their experiences of birth, refugee women in Sydney and what places and spaces make them feel safe. So lots of really interesting methods in there, if you're interested in following that up. And finally, where to from here? So in the future, and in the future, these are the things I'm working on. So with the Centre of Excellence for Automated Decision Making and Society that I'm part of, I actually lead the health focus area of that Centre of Excellence. And so we're looking at new and emergent platforms for healthcare delivery using digital tech. And we're looking at the imaginaries. I referred to the imaginaries there previously, but we're looking at the imaginaries. So what is promised in Australia? But what is actually existing is a very different story from what is promised by government or by tech developers. So we're mapping what is promised, looking at grey literature and news reports, as well as academic literature, and actually trying to work out what is actually, compared with what is promised or imagined, what is actually happening in Australia. So that's what we're doing right now. We're doing the project, I mentioned briefly, a project on digital health startup cultures, talking to people who actually are working in the startup sphere, and how they imagine what it is they do and what imaginaries they have about the possibilities offered by digital health. I'm also looking at new forms of peer connections and sharing. I'm really interested in TikTok at the moment. I've got a wonderful researcher in the Vitalities Lab, Claire Southerton, who's done a lot of work on health-related TikTok use and communities. And we're about to talk to young people about how they use TikTok to share information about health, for example. there's a huge amount of health information on TikTok, including, oh, there's my timer, so I'm about to stop. But I will just finish this slide. We are very interested in how young people use TikTok to share information, but also the health professionals that they engage with, because there's a lot of health professionals on TikTok doing really interesting stuff around getting back to health education, sexual health, COVID health, just health around, puberty, lots of, really important and, very, very valid and useful and shareable information there on TikTok that we haven't yet to scrape the surface of, really, looking at what's going on there in that space, which is hugely popular, of course, with young people. I'm doing a project with colleagues in New Zealand on dating app use in COVID times, where we're doing the story completion method that I talked about earlier. I'm writing a book on the Internet of Animals, so that's my next book. So I'm just putting that out there. I don't have time to talk about that, but that's my sort of next book that I'm going to be working on very soon, looking at smart agriculture all the way through to sort of grumpy cat memes and everything in between, and also the way that people use monitoring apps to monitor the health of their companion animals, of their farm animals, and also of wildlife animals, of drones. There's all sorts of exciting things to talk about there. And just working more on creative methods, so making, imagining, speculating, exhibiting. So actually, I've got another fantastic member of my team who is an artist and knows about curating exhibitions. So we're working on a project that involves sculptures and turning people's health data into sculptures. So that's just a few of the things I'm working on right now. And I'm really interested to talk with you some more and answer some questions or have some discussions. Thank you very much.
Thank you so much. This is great. I have several questions myself, but I don't think I should take over the entire floor. So I would love to hear from other people. And Jeff, I think, is going to moderate from the chat to bring some of those questions forward, and I'll jump in when there's a chance. So.
Wonderful. Why don't we go to Karen had a question about remote methods. Karen, do you want to come on and read your question? Go ahead, you can feel free to unmute.
Hi, thanks for that. Sorry, I've got a noisy backdrop. I love the presentation. Thank you so much, Deb. So I'm curious.
Another Australian.
Yeah,
Another
I'm an Australian in California.
Oh, right. Fabulous.
But lovely to hear your accent as well as your work. But one of my questions I have for you is whether you had cases of using these remote methods with people who have low digital literacy. And if so, do you have any learnings that you can share with us?
Well, to be honest, Karen, we kind of made, well, it's interesting, for example, with the project about people's homes and digital technologies. Of course, they had to already have digital technology in their homes and to be using them for them to be eligible for our study, because, that's what we were interested in. So, I mean, it would have been really interested to look at non-users, but, basically what would they show us? Oh, look, here's my house, there's no digital in there. It's a very pertinent point, and so far we have mostly used people who are digitally literate, because if they're going to be, again, in other projects, they need to be able to know how to use Zoom for us to be able to do something with us. Otherwise, it obviously is very difficult. But here's where I would say to go back to the analog methods and using pen and paper, sending things in the mail, which, older people, for example, often feel much more comfortable about. So I would say to, think creatively about using older style methods that are analog, even if you want to ask people about digital methods. That can just be a really productive way, really generative way.
Let's go to Alvaro, and then we'll go to Casey.
Hi, yeah. So again, thank you for the presentation. Question I had was just to kind of riff a bit on what Karen brought up, but because we talk about digital literacy, and then we also talked about the possibility of using the more analog methods, but a lot of these are also kind of dependent on being literate. So I'm just wondering if there was any instances of, because I've seen people that are not literate, but yet can kind of work a smartphone. So have there been any instances or any ideas around working with illiterate communities who have access to technology, and maybe by extension to that too, like people with accessibility issues who may have like access to like a human API, so to speak, with something like, I think of technologies such as Be My Eyes as an app, for people with vision disabilities. So I'm just wondering if there's any experience you had with that, or if anything you heard about that in terms of actual literacy or accessibility issues.
Yeah, it's really, really important issue. I don't work personally a lot with people with disabilities, or I do have members of my Centre of Excellence team who actually focus on disabilities. One of the other chief investigator in my university, Jackie Leach Scully, is a feminist bioethicist who focuses on disabilities. And so they are actually working on doing a lot of the mapping around what devices exist and what are helpful for people with disabilities, which is fantastic. So they're actually supplementing here. It's really great that she and her postdoc that she's working with are really focusing on that dimension. I do know that, so yeah, it's not something I've worked with a lot myself, but I do know, for example, that again, if we get back to literacy itself, I do know that, for example, methods like story completion or any kind of creative writing prompt, for example, you can actually ask people to respond to verbally, and that's done a lot with young children actually. So you can ask people to respond just by telling you a story.
Right.
And I do know I've got colleagues in the Centre for Social Research who work with people with intellectual disabilities, and they use methods like storyboards where they have images of people doing things. And I guess if someone has a problem with eyesight, then again you could describe it to them and ask them to recount a story verbally. Or if they're dealing with an intellectual disability and they're not very literate and have difficulties expressing themselves or reading, then yeah, you can use images. Images can be incredibly productive for people there, and you can ask them to tell a story just by selecting pictures, for example.
Right.
So, but yeah, to be honest, I'm not a huge expert, but they're just some of the methods that I've heard about.
Okay. Great. And I'm just going to put a link to the Be My Eyes in case it's a really neat app where you can kind of become the human API for a non-sighted person to just do random things.
Great. I mean, I do hear that home assistants, digital home assistants, work pretty well these days, even for older people. I've got a colleague who's actually done fieldwork going into older people's homes and seeing how they're using digital home assistants, and that can be great for people with mobility problems or literacy problems, because they just ask questions of the home assistant with Google Home or whatever it happens to be, Alexa. And that does actually seem to be really helpful for people with mobility issues or literacy issues, just to use voice commands.
For sure, yeah. No, and actually we're in the process of building an aging in place home for my in-laws with my wife and I, and these are things that we're considering, right? In terms of like, okay, how can we automate things, but also, how can we almost like put in a level of security in the sense of if somebody falls, we can turn on a camera and see like, do they need assistance or not, but at the same time while respecting their privacy. And so it's kind of an interesting world to be entering into as well.
Yes, absolutely.
All right, well, thank you very much.
Casey, would you come and ask your question about TikTok?
Yeah, sure. Hi, Deborah. Thank you so much for that presentation. It was wonderful. I'd love to learn more about your TikTok study. Are you using prior participants? Are you working with participants from another study or getting referrals from that? Or are you sort of sourcing those folks via a specific health-related hashtag?
Yeah, it's a really good question, Casey. We're just in the process of recruitment right now, and we want to recruit teenagers, and we have ethics approval and everything. And our original idea was to make a TikTok ad, which we did do. Trouble with that is you can't target it as well as you can, say, with a Facebook ad. I mean, for all Facebook's failings, it's very good at targeted advertising. And so we put we made an actual TikTok ad and we posted it on TikTok. But the problem is we got a lot of people, time wasters, who, I mean, we only wanted Australian teenagers of a certain age group. We were getting all these people from didn't even live in Australia, and certainly weren't, he just, because we did offer a small incentive, and, and unfortunately, we just got a whole bunch of people signing up who weren't in our target group. We're doing a little bit of snowballing and going through schools at the moment, through schools that we know and teachers that we know, just using our personal networks. I mean, I myself have a 16-year-old daughter who's just in our target group. So I've must admit, I've used her networks a bit. She's a very keen TikTok user. We've got some advice from her. But it has actually been difficult. It's been difficult targeting the recruitment and getting to the people that we want. And so we're still actually working out the best way. So we're using lots of different methods. And I think snowballing is probably going to be one of the main methods. It's not meant to be, huge sample. It's meant to be an in-depth sample, a small number. Fortunately, it's not like a big survey or anything. And I'm actually thinking we might use an Instagram ad next as well. But it's no point using Facebook because, of course, they're not on Facebook, this group. I don't know, do you have any, if anyone has any suggestions, I'd actually be keen to hear them, because it actually has been, it's been a bit difficult recruiting them.
I mean, TikTok's all about the influencers. Get one of them to post, that's your advertisement right there. Even if you find one that has a small, very committed sample of followers that's in that age group, I'm sure it could be a low-cost ad.
Yeah. Again, we just have to make sure it's only Australians, because the trouble was we just got way too much interest before, but it wasn't from Australian kids. But no, that's a good, if we can maybe find an Australian-based influencer, they probably only have mostly Australian-based followers. But thank you for that. I'll chat to my team about it.
Maybe one of the health experts you mentioned who were doing sort of adolescence and puberty and sexual health stuff, maybe if there's a sort of a reputable figure there that has both a legitimacy and a good following with young people.
Yeah, absolutely. Because we actually want to look at that, how people are engaging with that kind of content. So that's a good suggestion too. Thank you, Jeff.
Let's go to Arpita.
Thank you so much for this talk, Dr. Lupton. I've been following you on Twitter, so I'm a Twitter fan here. And
right.
My question feels like it's building up to Alvaro's question. How did you handle distance methods for individuals who do not speak English? So when we were trying to provide education, at times we had to get a live translator for the language of the audience. And I'm just wondering, distance methods seem hard. You have a lot of creative ways to get to it. As you mentioned, through art, doesn't necessarily have to be words. But I'm wondering if you've encountered that in your work, and how did you kind of get around it?
Yes, well, it's clearly, it's gets back to literacy issues and and just how to communicate with people. I tend to, we are a very diverse community in Australia, particularly in somewhere like Sydney. So, of course, we have many people from non-English speaking backgrounds who live in Sydney. Although I know that other people who work a lot with mostly people from non-English speaking backgrounds would tend to work with translators themselves. They would get people who speak the actual language to work with the people in their own language if they can't speak English fluently. What I tend to do when I recruit people is I just say that because I don't usually focus on cross-cultural issues, I'm happy to recruit, you know, I'm more than willing to recruit people from diverse ethnic backgrounds, racial backgrounds. But I ask that they must be able to speak English well enough so that I and my researchers can chat with them. But, so that's how I get around it. I actually insist they must be able to be included, they must be able to speak English. I mean, I do want to include people from non-English speaking backgrounds, but people who can speak English well enough so that we can do the research with them. But I do know that people who work with people who don't have that level of English language fluency, then they, yes, you do, it's very common just to use people who speak that language, because we have a diverse academically trained group of people. You know, we have a lot of people in Australia who, for example, are fluent in Chinese dialects because we have a massive immigration, you know, from China and from India and from European countries like Italy and Greece, of the older tranche of immigrants. So we would be able to quite easily find people who could work with those people in their own languages, and then we would obviously have to have the transcripts translated so that people like me could read them and work with them. So that's how we would do it.
I thought this might be a good time to actually come back around to Melissa's questions or comments here as well. If you have one of your questions, Melissa, that you'd like to ask.
Yes, thank you. I am interested. This is a very self-serving question, because I spend a lot of time doing ethnography and interviews with elites, with corporate elites mostly. And a big challenge with that community is that there is very often a very big gap between what they say they are doing and what they are actually doing. I'm sometimes asking them some difficult questions that they might not want to divulge. So in a distance environment, in a COVID context where I'm still trying to kind of get close to these people, do you have suggestions for trying to get at, normally I pay so much attention to body language and to pauses in the way they speak. And, sometimes I sort of jump into spaces and try to get them to say something a slightly different way than they might have said it originally, and so on. So I would worry that in a distance environment, I would miss out on all of those nuances. So perhaps maybe from your work with startups or other work with professionals in the corporate environment, how might we think about distance methods to access that kind of information?
Well, Melissa, you probably have more solutions than I do, because I wouldn't claim to have a huge amount of expertise in working with that kind of group. I have some experience working with healthcare providers like doctors, who perhaps might be a comparative example, studying up as they call it, working with elite groups of professionals who in some ways, might be more likely not to be as open, I think. But look, I think it's a really difficult issue when you can't share the space with them, as you mentioned. I'm not, and that does come up. I've noticed some other people talk about the issue too, with a contrasting group of, say, highly vulnerable people who've been through highly, challenging situations where they've felt unsafe. And being able to get the trust of those people who, of course, may have difficulties developing trust with a researcher, and for obvious reasons. I think the same problem exists in that sort of situation. I think distance methods can't solve every research problem, where this issue of trust, and in your case, in your group, it's sort of the trust you need to feel in your participants, I suppose, and being able to trust how they're reacting to your questions and be able to pick up any kind of issues that you want to follow with them in a way that you feel that you're getting the kind of story from them that you want. I do think it is an issue with distance sometimes, that you can't always solve that problem. Having said that, telephone interviews, which of course have been around for a long time as a remote method of research, there's a lot of literature on the pros and cons of conducting interviews by telephone instead of face-to-face. It's been around for decades now. So people have been discussing that for decades now. And I've done some telephone interviews recently with people about their experiences of COVID. And sometimes that remoteness can be a good thing because people are more likely to divulge things to you because they don't have to look you in the eye. And they feel safer about just talking to a voice, disembodied voice on the phone. And, that doesn't involve a lot of digital literacy either, does it? It's a telephone that people, nearly, or everyone, I would say, pretty much knows how to use a telephone. Even if it's just a regular telephone, not a smartphone, people know how to use a telephone and they're used to it. So maybe thinking about the old, going back to, old school telephones.
Yeah.
And I don't know, maybe your group of people might feel more likely to divulge some things if you're not eyeballing them. Who knows? Might be worth trying.
Yeah. I was thinking of some of the other creative methods you mentioned, like storyboarding and so on. And I was thinking, how would I get these people to, to come along with me on that? But maybe the phone, I'll start with the phone, see if I can.
Yeah, well, see, the story completion method's an interesting one because it's traditionally been used, as I said, in psychology and psychiatry. And it started off being used for social research. Well, it started off being used in psychiatry as a therapy, where people were just psychiatrists are trying to work with their clients to help them talk about their feelings, but in a slightly distanced way, so that they were talking about a fictional person, but really they were talking about themselves. And feminist psychologists have mostly used story completion in research to talk about very personal and private issues such as sexual practices, sexual infidelity, body hair removal practices, all sorts of really interesting, very, very personal issues. And they think that one thing those researchers really promote that story completion method is because it is about a fictional person, people often feel safer expressing opinions or feelings. So that can be sometimes going about it in that sort of indirect way can actually be a really good way to discuss really sensitive issues with people, very personal issues.
Thank you. That's giving me some very good ideas. Thanks.
Okay, well, I think we're aiming to wrap up at 8:15 to be sort of sensitive to Dr. Lupton's time and to, but I want to just, give a last kind of opportunity if anyone had a last kind of question here to jump in.
Yoni, did you want to talk about, I saw you put some stuff in the chat. I didn't know if you wanted to jump in with your.
This has been a fascinating conversation. So thank you so much, Dr. Lupton, for your time and your insights. I do work with the Latino community and kind of combine different qualitative methodologies to do so and explore how people are understanding health information and sharing and acting upon it, but getting more of the context of what that presence and the sharing online means to them. So it's not just ethnographic, but also interviews and then capturing data. And something that has been really challenging now that I'm starting to move from Facebook into Facebook and WhatsApp data in a pandemic with older adults who feel comfortable using the affordances provided for very specific things. Right? It's easy for my grandma to forward a message on WhatsApp, but maybe not so easy for her to search for content within the app to send it to someone else if it isn't something that's immediate. So I've just been struggling and thinking about how to do that when you then add an element like Zoom into the way that technology is being used. And yeah, it was just more of a thought that emerged from this great conversation. So
yeah, that's a really interesting reflection. And I mean, what I'm finding in my own research, talking to Australians about their experiences of COVID, is that, of course, some people were forced to actually suddenly learn how to use Zoom, not just for work, but for talking to their grandkids if they were older people, because that was the only way they could do it. And in fact, they found it really great because it was the only way they could see their grandkids. They could actually see them, you know, not just talk to them through the telephone. By using Zoom, they could see them. And a lot of older people really valued that. And they did manage to do that and learn a bit of digital literacy just because they were forced to do it. But I'm also thinking about this project that I did with my colleague, Larissa Hjorth, who's a digital anthropologist. And she collected some field work in Japan, talking to adults who had older parents living in a different space from them, which is quite unusual in Japan. It's only really happened in the last generation that older parents didn't live with their children, but it's happening more and more. And we looked at what digital technologies we use to keep that digital sort of intergeneration caring, that sort of caring through digital technologies, which we've sort of referred to in a different context earlier in this discussion. And what we, you know, there's all this talk of, you know, oh, robots and stuff in Japan are going to be looking after older people. Well, in fact, it gets to that kind of big gap between the imaginaries of digital tech versus the lived experience. What we found with our field work was that older people were quite happy using a messaging app, Line in Japan. That's the name of the messaging app that's really popular in Japan. And using little stickers and emojis and things to communicate with their adult children, and, you know, show them that they're okay, and just to keep up to date with them and to have that line of communication going. You know, so forget the care robots. Sometimes it's something just as simple as a messaging app that older people often are very, very able to use and enjoy using.
If there are no more questions, I don't see here, I want to take this opportunity to thank Dr. Lupton so much for your time and your generosity. I really appreciated how you walked us through your, not just your theoretical frameworks, but also thinking about how we can all be a little more expansive in the kinds of not just materialisms, but frameworks that we can draw on to do the kind of work we do. It's, I think, very important to keep reminding ourselves of that. And then also bring our focus to digital culture in a way that's very sensitive to the communities we're working with. So we're really grateful to have had your time and your talk with us today.
Thank you. Thank you for inviting me, Melissa and Jeff, and it's been great to meet you all virtually. Hope to see you in real life one day.
Yeah, when you begin your travels again in a couple of years, we'll hope to see you in person.
Yes.
Yeah.
Fantastic.
So thank you, everyone, and thank you all for attending.
Thank you, everyone, and special thanks
to everyone.
Yeah.
Bye now.
Goodbye.
Bye. Thank you. We're closing out. Thanks, Jeff. Thanks for moderating.
Yes, that was wonderful.
Yeah. Yeah.